Okay, this is examination of the shoulder. This is my patient Richie. We're just going to start off with just looking at posture to start off with. So just put your feet apart together there. So we're just looking at general body alignment. If you'd just like to walk just there for me, so just looking at gait, any abnormalities with that. Let's come back here. So there's no obvious abnormalities in alignment of the body. If you'd like to squat down for me, please. Any pain at all, any difficulty with that? So we're just looking for core body strength with that, okay? So now we're just going to inspect the shoulders. Okay. That's fine, there's no issues there, good alignment, the shoulders are not swollen or red, and there's good, there's not one shoulder is more elevated than the other. If you'd like to turn around for me, the camera. So we're looking at about here, we just reveal, just look at the vest top here, looking for the scapular alignment, any issues with that. Again, the shoulders are well aligned, there's no issues with muscle bulk or wasting or atrophy there that we've noticed. That's fine. If you'd like to turn around for me, please. So now we're just doing a quick distal neurovascular examination, okay? So if you'd like to squeeze my fingers on both sides, there's good power there. If you'd like to bend your elbows up for me, and just resist that, and then push down, and then lift up your arms for me. So power is normal in both sides of the arm. If you'd like to put your hands out for me. Any problems with sensation there? Can you feel that normally? Same on both sides. Same here. So again, sensation is normal. So neurovascular status appears to be normal and appears to be pink and well perfused. Now we're going on to palpate the shoulder. So we'll just demonstrate it on this side. So we've got the clavicle here. So sternoclavicular joint. Any tenderness here at all? We're moving away across the clavicle. Any tenderness with the acromion? Any pain here at all? This might be tender in AC joint problems. Now we're going around to the humeral head. Any pain there at all? There's no pain. And we would do the same on the other side as well. And then just have a look at the back here now. So seeing if there's any pain on the scapula. Any pain on the scapula you noticed? And we do the same on the other side as well. Just turn around just like that, so just for the benefit of the camera. Okay, and then we're just going to have a look at the scapular movements. So if you can just elevate your shoulders for me, both shoulders, just shrug your shoulders for me, shrug your shoulders and then down. So your scapula moves symmetrically, and then inwards like this, so you're moving the shoulders inwards like that. That's it, and then outwards for me. So the scapula move in a symmetrical fashion, in a normal fashion there, no issues with that. If you'd like to turn around for me please, Richie. There. So now we're just going to test range of movement in the shoulders. Okay, so if you'd like to lift up your arms for me. That's good. And I'd like to bring them down, no pain at all. And then inwards like this. And then inwards again like this, other side. So add adduction, abduction, no issues. If you'd like to put your arms out like this, move them out to the side. And then move them inwards for me. Again, there's no apparent issues with that. And now we're going to just do a flexion. So we're just going to move the arms straight up like this. Just straight up by the body, if you wouldn't mind, just by the body like that. That's it, just straight up, that's it. So no issues with flexion, and then back as far as you can, and just testing a little bit of extension there, that's fine. Now we're just going to go on to doing the special tests that we need to do, just in case we suspect any issues at all. So if we expected impingement, we would do this particular test. So if you wouldn't mind just following me with the command there, empty can type of test. And we're just going to press down on the shoulder. The pain would be provoked if there was impingement. Any pain there at all? No. Okay, that's good. And there may be limitation when we do the external internal rotation, which we've done before. There could be some issues with that as well. So for example, if we just get the arm like this, and we're just going to turn it inwards, okay? So pain or limited movement could be provoked if there has impingement. So that's, thank you very much. If we thought you might have a slap tear, there's 3 screening tests that we could do. One of which is abduct the arm, so we're just going to move your arm up like this, and press down on the arm. Any pain there at all? Pain would be provoked if there was a slap tear. That would be internal injury to the shoulder. Any pain here? So when we press down on this area? No. So again, that would be provoked if there was a slap tear. And now we're going to do another thing. So if you wouldn't mind just moving your arm out like that. So resisted supination, no pain on that? That would be painful if there was a slap tear. And then if we suspect a slap tear, we've gone to do our Bryan's test. So our Bryan's test, if we just move the arm across like this, and downwards with the thumb down, that's it. I'm just going to press here. Any pain in the shoulder there? It does always feel a bit tense. There's no pain on that, so that's unlikely to be a slap tear. If we thought there was any signs of instability, we would then go on to do this test. So what we do is we stabilise the scapula on the affected side, and then we get the humeral head here and move it forward. Does that feel unstable? So there's no apprehension there, and then push backwards. Doesn't appear to be any issues there at all. So again, there's no obvious signs of dislocation or instability of the shoulder on that examination. If we thought there was a biceps issue, if you just again try and go forward like that, there would be pain on resisted supination, and there may be pain on palpation of the biceps. Any pain at all? At the origin of the biceps on this point here, and there might be some pain down there. Okay, thank you very much. That concludes our examination of the shoulder. Thank you. Good, that's much better.